So I'm a pediatric emergency medicine physician. And so when children come in, they're often scared. They may be sick or injured. Their family is obviously very worried. And so the position of child life specialist is really that hero that we work together with to help calm the family, to help calm the child so that they can know what's going on, what to expect. And they really help us do our emergency work that we need to do to help the child with their injury or their illness.
I think probably the most important thing is we are the main advocate for children and their families. So a lot of times when children and their families feel like no one is listening to their needs, we are the people on the front lines with them that are advocating for their needs and translating what they need to the medical team.
Cami works primarily in the ED, and my function as a liaison is how do we make the ED a more child-friendly place? How do we make them feel secured, especially when they're here for days, up to weeks, even months, sometimes depending on their current situation? She helps me help them feel loved.
When I accepted the role here at Duke Children's, my time was originally going to be half in the ER and half in the outpatient clinic world. And so I advocated to make sure that we would get full coverage in the emergency room because I knew that's where children and families could benefit the most from child life. And so I really advocated and showed the need for a full-time position. Luckily, they listened. And from there, we were able to add on another full-time position in the ER so that we could have full coverage.
I was here for a long time with no child life. Our institution had child life, but they were in the pre-op area. They were on the inpatient units. And I used to work in the inpatient unit, but we didn't have it in the emergency department, and all our peers did. And when we got it, everybody's like, oh my gosh, this is amazing. Cami often is in the room before we're in the room. If somebody's really sick, of course, we're gonna walk in instantaneously, but Cami oftentimes has assessed a kid before we've even rolled in there and said, hold on, I need to do this, this, and this to help you take care of this kid, which is just huge.
We've seen a sort of record number for our hospital of younger children and teenagers coming in with behavioral health concerns, and then the resources in the community aren't adequate. And so Cami has realized this was a problem, has partnered with me and others throughout the institution to come together with a plan of how can we normalize this for patients when it's not a normal experience to spend many hours or even days in an emergency department waiting for the care you need.
Her coming in and helping us to think through what do we need to do for these patients to make sure that they're getting normal rest and we're doing things to help de-escalate situations early by providing resources to them and things for them to do has really changed the way that we've been able to provide care to these patients, to make them have a better experience and to keep them safer.
She truly is just incredibly compassionate and has a passion for taking care of these children.
She works really well with patients and families. She builds rapport with them really well. Even if she's having a hard day, she leaves that at the door and focuses on patient and families first.
Cami is most deserving of this award for many reasons. Just her ability to work with her child life team. She finds ways to make connections with every person on the team. Lots of fun. She definitely has a funny sense of humor, but she also is a great team player and just a great communicator in all aspects of her work here at Duke Children's Hospital.
Congratulations, Cami.
Congratulations, Cami.
Congratulations, Cami.
Cami, I am so happy for you, but not surprised.
And we are all here cheering for you and very excited.
Cami, I'm so excited for you. You're so deserving of this award. I'm just really super happy to have been part of whatever went into this recipe that got you this award. I hope you will keep doing this work every day of your life. Don't retire. You're not allowed to retire, especially not before me.